Welcome back to Little Growing Bones. My name is Jitna Sazi. Today we are going to talk about a very interesting topic. Have you seen your teenager limping around the house, maybe looking a bit off? Perhaps they just rub at the front of their thigh, or just casually mentioning that maybe their knee hurts, or it just feels weird. It's so easy to just skip over this and just brush it off and think that, they're just pulling another strand. But it's probably something much bigger going on. You think maybe it's a growth spurt. You've asked them to stretch things out. You think it's growing pains. And you can't seem to explain why it's happening, but it just won't go away. But what if it's like that nagging ache, that subtle shift in their gait is something much bigger than what you're anticipating? The real issue could actually be something much bigger, something deep inside their hip that's silently killing their hip. So without the proper attention, this condition is actually scary. But today we're going to understand it, and it could be the key to you protecting your child's hip for future mobility. So now I want you to picture something with me. Like imagine the top of an ice cream cone sliding off of the ice cream cone. That condition is called SCFE or SCFE in some literature. The good news is that this condition can be treated. The thing is that if it's not treated, it can actually cause very bad pathology to the hip. So that exact unsettling image could be happening inside your child's hip. And if it's not treated correctly, it could cause very bad detrimental effects to your child's hip for the rest of their life. The issue is that it normally presents as knee pain or thigh pain, so it's easy to disregard it, but it needs to be treated urgently. So what are we talking about exactly? This condition is called a SCFE or a Slipped Capital Femoral Epiphysis. In short, it's SCFE in some places or SCFE in other places. So don't let the big words scare you. In plain language, just means that the growth plate of the hip is sliding off. This area is very vulnerable, and it can easily get injured in some events. So the femoral head is what sits on top of the thigh bone. When it starts to slide off, it sits inside the socket or the acetabulum. So think of this structure as I initially mentioned, an ice cream sitting on top of a cone, and when it starts to slide off, it causes a painful event. This isn't some rare freak accident that only happens in medical textbooks. In fact, SCFE is the most common hip disorder affecting early teens, making it something every parent of a growing child must know. It's not a question of if it happens, but when, and to like the broader population. So who exactly gets a SCFE? What we know is that it occurs quietly. It tends to happen in children typically between the ages of 10 to 16 as they're still growing, and this is the time when they're having the peak growth. It tends to be more in boys and more in children who are a bit heavier. So during these years, their growth plates are particularly active and consequently a bit weaker and more vulnerable. So we see it more in boys than in girls, to a ratio of about 2:1, though it can certainly occur in any girl, really. So one of the biggest risk factors, and one that's actually increasing markedly in our population, is it happening in children who are carrying a bit of extra weight. So when a child is overweight, the increased mechanical stress and the constant force when they're still growing growth plate is quite significant. So imagine pulling on a piece of soft, fatty tissue that is under so much pressure. That is what happens to this growth plate. The other shear forces that are also happening in the joint are still going on every day. So things like running, walking can literally push on this femoral head out of its normal alignment. So beyond the weight, certain hormonal shifts can also play a very big role. Conditions like kidney disease, thyroid problems can disrupt the delicate balance of the hormones that regulate the bone growth and can affect the strength of this bone, adding to another layer of danger and making the growth plate even more susceptible to slipping. So if your child checks any of these boxes, if they are in that age range, if they're carrying a bit of extra weight, if they have a history of endocrine issues, then the clock is unfortunately ticking for them, and they stand a high risk of getting this condition. What are some of the smoke signals? How do you know to spot this sneaky condition? So you need to become a detective, looking for the smoke signals before the fire gets out of control. Watch for things like limping, that might at first glance appear painless. Your child might not even complain about the pain while limping, but rather describe a general discomfort or stiffness. This limp often gets worse noticeably after periods of rest, like when they're sitting for a long period of time. After some physical activity as well, it can occur. The classic complaints aren't actually in the hip, and that's why we easily miss it. Most of the time, the complaint is knee pain or pain at the front of the thigh, or generally pain around the thigh and the groin. And it's that referred trick pain that makes the hip the guilty party, but the knee often takes the fall. Another telltale sign is a change of how they walk. Sometimes, typically, if a child has been walking with their feet straight and then suddenly the foot is facing outwards, that is a tell sign. So the external rotation is a very strong indicator that something is not okay. They might also struggle to rotate their hip inward. So if you ask them to stand with their feet facing forward, you notice that they're having difficulty doing that, or they'll complain of pain. Now, sometimes the slip happens quite suddenly or dramatically. This is called an unstable SCFE. It's much more serious indeed. So, and that's an acute condition. So in these cases, your child won't be able to bear any weight. It's like they've broken their bone. The pain will be very severe and it's quite immediate. This isn't just a red flag, it's a blaring siren, so indicating that surgery is needed urgently. You need to pay attention to this because if not attended to, it will just lead to very bad issues for the child's hip moving forward. Why are we in such a hurry to treat this? So you might be thinking, okay, they have a limp, maybe some knee pain, why the rush? So the urgency here can't be overstated. Every single millimeter that the femoral head slips out of place is further damage. And it's compromising the blood supply to that area of the bone. This is a huge deal because if the blood supply is cut off, the bone tissues will stop living. So imagine, I know we've talked about a vascular necrosis here before, so you can go back and refer to that video. But when the head is not receiving blood supply, it starts to get destroyed. And this leads to things like chronic pain and degeneration, and causes them to walk funnier, causes them to have a limb discrepancy, causes them to have persistent pain all through life. And ultimately, they might need to undergo big surgery like a hip replacement surgery while they're much younger. So in the absolute worst case scenario, a healthy active kid can also, in the worst case scenario, a healthy child can have their life transformed into lifelong pain, needing multiple hip replacement surgeries, enduring pain, having limited mobility, and just, leading them to a less active life. So the rest is against the clock. You need to protect the child's hip and their future and their quality of life in general. So we have a very narrow window of opportunity to intervene and change the trajectory for these children. There's an exam that can be done to actually help us confirm clinically if it's SCFE or not, or to increase the suspicion of it being a SCFE versus something else. This can look like very many other things. It can look like a fracture of the hip. It can look like an infection of the hip. But one test that we can do is just ask the child to lie on the bed facing up, and then we bend their knee. So typically, when we do this in a child who's a SCFE, you'll notice that the foot or that the hip has a tendency to rotate outwards. So something called obligate external rotation of the hip. And that test can help you know if it's a SCFE or something different. You can also have them stand up and just observe their feet. And as they walk, they'll typically tend to have their foot face outwards. If it's an unstable SCFE, they might not be able to walk at all. All right. But also we look at the history of a child who's probably walking just fine. They don't have any history of a significant traumatic event, but now they can't walk because of severe pain. Hip joints or the femur bone doesn't just break. Think about a SCFE anytime you hear things like this. You need to go into the hospital and see the doctor as soon as possible. The time is of the essence, remember, all right? So how do we treat it? How do we treat this? The good news is that amidst all the seriousness, once a SCFE is suspected, the treatment can be offered. But first things first, you need to get an X-ray of the hip and confirm that this problem is actually present. An X-ray is able to show us what is going on with the hip, and we're able to compare it with the contralateral side, with the other side, and see if there's anything that is out of the ordinary. In some events, it's still very acute, and maybe the hip hasn't slipped off, and so investigations like an MRI scan might come in handy to help us see the early signs of inflammation or just changes around the hip joint. A slip, even just a slip of a few millimeters, is enough to just change the dynamics of the hip joint, and therefore it needs to be managed as soon as possible. The treatment is surgery. So the surgery requires us to have the child, take them to the operating room, and give them anesthesia. When they get anesthesia, then the surgical team will get to work. They will put a screw to hold the bone in joint. Typically, if you read through the literature, they'll tell you that this surgery is called pinning. So depending on the age of the child, they could either put a pin or they could put a screw. And the goal of the screw is just to hold the bone in place and prevent it from further sliding out of place. The screw will be in until the bone is healed. And then it's up to you to decide if the screw is removed or not. Of course, the complications as a result of this condition, one of them that we mentioned earlier is a vascular necrosis. Like I mentioned, we've talked about we have a video on a vascular necrosis that we made a few weeks back, and you can refer to that. Sometimes the implants could penetrate into the joint, so that's a bad complication, requires the screw to be removed as soon as possible. The surgery does prevent the progression of the condition. However, it doesn't change the pre-existing deformity that has developed. So the hip will stay in that position, and the child will still have that external rotation gait, but the pain will go away, and then they'll be able to carry on with normal life. There are different surgeries that can also be done, things like surgical hip dislocation and all, but that's like story for another time. So the recovery is pretty quick. Once the screw is put in place and everything goes well, the child should be pain-free in a few days to weeks, because then the hip is not sliding anymore. They're allowed to start physiotherapy, to start moving the hip around, and then we'll wait for the wound to heal, and then they can go back to their normal life. So most kids are able to get back to their favorite sports as soon as allowed by the doctors. However, there may be some temporary restrictions, like high impact twisting sports might be limited, things like basketball, soccer, but other things can be agreed. But then again, discuss with your doctor and understand the limitations of what you can do and what you shouldn't. So your orthopedic surgeon and the physiotherapy team will provide specific guidelines that are tailored to your child, their recovery, and the extent of their sleep, and what they can do and what they shouldn't. So the aim is always to try and get them back to being active as soon as possible, but safety is very important, without risking further injury to that hip. So if you found anything helpful from this video so far, don't forget to subscribe and share this video with other parents who might be concerned about their children's hips, or generally about their children's well-being. And we also have appointments that you can just check in the description below, set up an appointment if you have concerns about your children's general orthopedic state, so that we can evaluate that in an in-person clinic. So if you found this video helpful, don't forget to subscribe and share it with the parents who might benefit from this kind of information. And until next time, keep it on Little Growing Bones.